Hi there, good morning. Amy with Momentum Physical Therapy. What I'd like to do today, we're using the microphone for my headphones. We're having an issue with the iPhone recording sound, so we'll give this a go. Hopefully this works well. So what I'd like to talk about today is common back pain myths. And so I've made a list of the top back pain myths that I hear from clients or from things in the media that I just like to dispel now and set the record straight. So top 5 back pain myths. Number 1 is moving will make it worse. So it used to be the prescription or course of care that if someone had back pain, they would recommend several days of bed rest. What we know now through studies, through a lot of research, is that this is typically not recommended and can lead to a worse outcome. Avoiding movement is not going to be helpful and can delay your recovery. So gentle movement, keeping moving, walking, things that you can do are generally going to be helpful and beneficial for you. So no bed rest. Not moving is not going to make it better. It can oftentimes make it worse longer term. The second one is avoiding exercise. That if you hurt your back, you should avoid all exercise. And again, kind of along the lines of gone are the days of recommending bed rest, is generally continuing exercise or your normal routine with modifications is going to be helpful and lead to better outcomes. So you're obviously going to be decreasing the intensity or the duration of your exercise or your workouts. You're going to be modifying it probably with the help of a healthcare professional, a physical therapist, somebody like that. But continuing to exercise, continuing to move is going to be better long term. It can help speed your recovery. The third one is that the amount of pain you're experiencing equals the amount of tissue damage or the amount of or the severity of the problem with your back. So what we know is that, again, this is through research studies, is that the amount of pain someone's feeling isn't correlated to the amount or the severity of an injury or a problem in your back. So pain is really complex, and many things affect the experience of pain beyond just the tissue damage that's occurring. So the amount of pain you feel isn't correlated, isn't well correlated with what's going on at the tissue level, if that makes sense. We're number 4. A scan or an X-ray or an MRI will show exactly what's wrong. And unfortunately, that's just not accurate. The majority of low back pain fits in this category of what we call nonspecific. And what that means is that we can't attribute the back pain to a specific condition. There's typically many things that contribute to the experience of low back pain. You can't just say, oh, it's this one specific thing. Thus, imaging and X-ray and MRI in the vast majority of cases is not going to be helpful and was not going to lead to a difference in your care in terms of the type of treatment you receive from a physical therapist or your outcome, how quickly or how much you will improve. So the interesting thing about that, and I'll do another post on this shortly, is that most adults without low back pain, will often have changes in the anatomy of their spine that are age-related, meaning things like arthritic changes, disc bulges, disc degeneration, or what we call disc height loss. That's present even in people without low back pain. So a lot of those things we see on an X-ray or an MRI, or that people find on an X-ray or an MRI, aren't necessarily the source or the cause of low back pain. So the number 5 back pain myth that I'd like to dispel is that back pain is due to weak abdominals or a weak core. And that's not accurate. So we hear this myth over and over and over and over and over in the media. You'll see health articles about 5 core exercises to overcome low back pain or protect you from low back pain. So the reason that this isn't accurate is that many people have low back pain, even with very strong cores or abdominals. There's top athletes with low back pain. So core strength all by itself is only one component of the picture. Although it never hurts to be stronger, to be able to move in a coordinated fashion, it's only one part of the picture. So being able to resolve, I guess what I'm trying to say is that thinking that you're going to be able to resolve back pain, or everyone would be able to resolve back pain simply by having a strong core, isn't accurate, because then athletes or people who are very strong, or if you just did the core exercises, your back pain would resolve, and we know that that doesn't happen. It's oftentimes a much more complex issue to fully resolve. So chances are you or someone you know has had back pain or will have back pain in your life, and just keep these 5 back pain myths in mind. You'll probably hear some of these myths. You might even see one of these myths in an article today as you scan through the news. But keeping in mind that there are a lot of misconceptions and myths out there, and we're here to help you get the full story and be able to resolve your back pain efficiently and effectively. If you have any questions, go ahead and leave them in the comments below. Thanks.